I'm Dr. Bradley Lamm here at the St.Mary's Medical Center, Palm Beach Children's Hospital in West Palm Beach, Florida. So we're demonstrating the MINIBunion procedure, and you can see the setup here. We have my assistant, my fellow, holding the leg bent, or the knee bent, and the foot is flat on the table. We do have the bump here to give us the 15 degrees that we need for the x-ray, which is coming straight 90 degrees to the table. So our C-arm's set up here. And what we're going to do is be able to use this position for our procedure, and then we will also do lateral x-rays in this same position. So it's very critical to get good x-rays for this procedure, as you have minimal incisions to do this. This patient with a bunion, we're going to identify the level of the osteotomy through skin markings. X-ray there. This allows you to find the level of the osteotomy, usually at the metatarsal neck, or just proximal to the neck of the metatarsal. X-ray. We'll make the skin marking on the AP. Now we'll rotate the leg to a lateral X-ray and mark on the skin the lateral declination of the metatarsal. X-ray. X-ray. So here we're marking the lateral declination of the metatarsal. We'll take our wire and locate our level of our osteotomy. Insert the wire at the level predetermined by our skin marking. X-ray. Make sure we are orthogonal to the metatarsal. Go medial to lateral. Bicortical. X-ray. And locate the level of the osteotomy. Now I'll take the measuring device and I'll measure whether we want a long or short implant. The second thing is how much translation we want. X-ray. Here you can see that it's kind of between the short and long. But I'll err to the short side. That way we can ensure we don't bottom out on the base. Knife, please. The second part is understanding how much translation you want. And I'll make a 10 or 15 millimeter incision, erring slightly a little bit distal on that incision. Reset. Now I'll use a small wire. I'm going to mount this guide orthogonal to the metatarsal, and these are the temporary wires to hold the guide in place. The guide will be parallel with my lateral line on my metatarsal scale. Another small wire to the proximal end of the guide. This system allows you the guided version so you can be accurate, which is a big advantage of this MINIBunion system, to have AP X-ray. Now you can see nicely placed. We'll get a lateral X-ray now to ensure that we're 90 degrees to the long axis of the metatarsal. X-ray there, we're live. So now we're going to remove this guide and we'll replace the saw guide on, which allows us to place either an osteotome, if desired, or a saw. In this case, we're going to use a saw. We're going to leave the foot rotated. We're going to have two Sen retractors, or we're going to have two Ragnell retractors holding the skin. For our saw blade. We're going to insert the guide as close to the foot as possible in the incision. We're going to bend the wires to ensure our clearance of our saw. We're going to skive it halfway. Let the saw cool down. And then we're going to complete the osteotomy through and through the next passage. Now I'm going to take off my guide once I feel like I'm fully through. We'll go to the 18th. X-ray. You can see we're just about through. What I'm going to do now is just ensure by feeling that we're fully through the osteotomy. X-ray. X-ray. And we are fully through. You can angulate the saw blade or rotate it to see if you are complete. X-ray. Now I'll take the elevator and insert it into the osteotomy level. X-ray. And I'm going to use this as a broach up the canal of the metatarsal. X-ray. Check the lateral to see if we're in the right alignment. X-ray. And we are in the center aspect of the medullary canal. This creates a path to the MINIBunion implant. This is our implant, 3.5. It has a suture passer for our medial capsular repair. X-ray. Insert through the same region as our predetermined. Use this handle to insert it. X-ray. And you can see the translation nicely of the capital fragment. I'm going to bury the neck of the implant into the shaft. It's right at the level of the osteotomy. I'm going to obtain a lateral to ensure that we're down the canal with the first metatarsal. X-ray. And we are. Stay there. I'm going to put my oblique screw in through the shaft of the metatarsal. This holds the implant in the proper position. X-ray there. You can ensure that you're through and through by seeing the end of this guide. The guide is placed, drilled through that lateral cortex of the metatarsal, measuring 16 X-ray. So we take a 16 screw. This is a non-locking oblique screw. This locks your implant to hold your translation. Again, this will translate approximately 5.5 millimeters, which is the 2 millimeters of the shaft, the medial aspect of the metatarsal, and the 3.5 millimeters of the thickness of your implant. If you insert this screw deeper, you can impart more lateral capital translation. X-ray. I'm grabbing that lateral cortex. Now we want to realign our distal first metatarsal and get our rotation and ensure our angulation. We can rotate the hallux as shown here to help with that rotary position. X-ray. So I'm going to do this live under X-ray. I'm going to rotate the hallux. Go live. So here is rotation where you get the sesamoids underneath. Here's where she started. Here's where we'd like to place her sesamoids underneath the metatarsal head as shown here. So you can hold the toe and rotate it as you insert the distal fixation point. And we have the distal guide. X-ray. So here you can see our wanted position. You can use temporary wires in the metatarsal head to hold it and rotate it like a joystick if you so desire. I'm going to check one last time the lateral to ensure my placement of my distal screw and positioning of my head. You can see there nicely that there's no translation. Nope. So as I hold my position, I'm going to insert my drill X-ray. X-ray. And I'll take my guide off here. And insert my screw. This is a locking screw distally, so now I'm locking my rotation, angulation, position. This is a fixed angle device, very stable. X-ray. Excellent. Now I can go back to my oblique screw, and if I tighten this a bit more, I can impart some compression as well as further lateralization of the capital fragment if I choose. So as I tighten this screw, I'll get some compression, which I feel, X-ray, and a little bit more lateral translation. X-ray. Save that. Excellent. So now we have a translation, a rotation, and we haven't changed any angulation in the AP plane, which is ideal. Now we're going to go to the soft tissue balancing, and that includes a lateral capsulotomy, medial capsular reefing. The plate allows us to suture the medial capsule to the plate and create a permanent soft tissue balancing. I'll have the beaver blade, please. I'm going to go in under fluoro percutaneous incision through the lateral capsule, X-ray, and make a small incision, release the dorsal capsule, X-ray, dorsal lateral capsule, and the dorsal medial capsule to impart release of the joint contracture being long-standing. Next, I'm going to take my suture, which is a PDS suture, permanent suture, and place that medially through the first metatarsal capsule, through the previous incision, beaver blade, distally between the neurovascular bundle, distally between the neurovascular bundle, a small percutaneous incision. This will reef your medial capsule. And again, through that distal incision, hugging the medial capsule, and exiting back through the previous incision. This is kind of a triangular type stitch that allows for reefing or tightening of that medial capsule, and it aids in completing the bunion correction. See, I'm pulling it through the proximal incision, and then this loop will feed through the suture passer.